everybody, Dr. Daniel. Today I'm talking about Triptan side effects. Triptans in 2020 are still the best acute therapy drugs for migraine, in spite of the arrival of 3 new drugs for acute migraine therapy this year. Triptans treat migraine acutely better than the new drugs. They act fast, they're cheaper since they're all generic. Medical insurance provides coverage for all the triptans. And in general, if one takes a triptan at the onset in 2 hours, 80% of migraineurs will be headache-free. And no drug can really beat that. The new drugs are Rayvow, Nurtec, and Ubrelvy. They just came out, and they're name brand drugs, which are more expensive than they will be later when they become generic. Over-the-counter drugs like NSAIDs, caffeine, Tylenol don't block the release of neurochemicals like triptans do, and they're only mildly effective for headache. Plus, opiate narcotics and butalbital drugs have no place in the treatment of migraine. Migraine is a genetically inherited familial medical problem. For women, migraine is the most common medical condition and more prevalent than hypertension, diabetes, heart disease, or arthritis. Triptan side effects, although real but not common enough or severe enough to prevent their remarkable widespread and universally accepted global use. Something like 25% of women have migraine, while 6% of men have migraine. And migraine should always be treated quickly at the very beginning of the headache, or if you have an aura, you treat it at the onset of the aura. So common triptan side effects are dizziness, injection site reaction, that's only with sumatriptan, which is the only injectable type drug, chest pain or discomfort, neck pain, neck stiffness, numbness, throat irritation, feeling of heaviness, flushing, sensation of pressure, and sensation of tightness. Less common side effects are abdominal or stomach pain, anxiety, blurred vision, changes in patterns and rhythms of speech, chills, confusion, and muscle cramps and stiffness. Related questions. Do triptan side effects prevent use of these drugs? Triptans for acute treatment of migraine are the gold standard treatment for migraine all over the world. Triptans have changed the practice of neurology, now giving millions of patients effective, rapid treatment of their migraine attacks. What if a patient can't tolerate one of the triptans? Triptan side effects are dose-related. Hearing side effects in the office on return visit, the doctor can easily reduce the dose and still provide effective migraine therapy usually. For instance, when sumatriptan first came out in 1991 as Imitrex, it was dosed in, it still is, a 6 milligram subcutaneous injection, which is now still the most effective drug, a dose of all the 7 different triptans. The first oral dose of sumatriptan was 25 milligrams, which was used for a few years, and then the 50 milligrams came out and for adults. And finally, the most commonly used adult dose is 100 milligram. If a specific patient has significant side effects on using the 100 milligram dose, the person can easily, very logically, cut the dose in half and use the 50 milligram size tablet, which hopefully will work for migraine treatment and eliminate side effects. Why is sumatriptan used so often? Sumatriptan has always been the most common go-to triptan because of the different dosing forms. There's a nasal spray, 3 sizes of tablets, and 3 sizes of subcutaneous injection. It was the first to come out, and its insurance coverage has always been more prevalent. Using sumatriptan, a migraine patient can take an oral dose for developing migraine, and if it doesn't work and doesn't go away, then it can inject with 6 milligrams subcutaneous sumatriptan in 2 hours if the headache doesn't respond to the pill. Also, sumatriptan subcutaneous 6 milligram dose works in 10 minutes and gives a dose in the brain of 100 milligrams, while the 100 milligram generic tablet works in 30 minutes and provides a brain dose of 30 milligrams. So, injectable 6 milligram sumatriptan is the fastest and highest dose triptan migraine dose available. What about switching to another triptan? The migraine literature and headache practice has shown that switching to a second triptan because of limiting side effects of the first triptan that was used will work at 60% of the time. What's the reason for the triptan side effects? Migraine causes cerebral arteries to vasodilate, and one of the ways triptans work is by causing cerebral smooth muscle vasoconstriction. Sometimes the smooth muscle in the esophagus or trachea also contracts, giving the very common triptan side effect of chest or neck tightness. Explaining this process to patients helps them understand and often accept the observed symptoms as not being serious, so they may continue with their triptan therapy. I always would ask the patient, yeah, you had this side effect. Did the headache go away? And they'll say yes and smile usually. Can anything be added to an acute therapy sumatriptan dose that will help? Glaxo, the original maker of Sumatrex, did the original pharmacological research that answered this question when they brought out Trexamet, a combo drug of 85/500 milligrams of sumatriptan and naproxen sodium. After this was used clinically, many migraine articles showed that using 500 milligrams of naproxen sodium with any of the other triptans would work better than the one triptan alone for migraine treatment. Now, 4 of the triptans have problems when taken with other drugs. These are Relpax, or elatriptan, is contraindicated with antifungals, macrolide antibiotics, or protease inhibitors. You can look that up on the internet if your drug has any of those problems. Maxalt or rizatriptan requires a 50% decreased dose when taking with Inderal or propranolol, which is a common migraine preventive drug that may be used at the same time that triptans use. Frovatriptan should have a decreased dose when used with birth control pills and Inderal or propranolol. Zomig or zomatriptan should have a decreased dose with Tagamet, which is cimetidine, but that drug has now been taken off the market. If the doctor and the patient may abide by these problems, the listed triptans should work well for acute migraine treatment. General triptan rules are: don't use triptans with a personal or strong family history of coronary artery disease. Don't use with uncontrolled hypertension. Limit the dose in children, the elderly, defined here as over 65 years old, and patients with basilar artery or complicated migraine aura symptoms which last over 40 minutes. Don't miss the triptans or take with ergotamine within 24 hours. This means it wouldn't mix sumatriptan with elatriptan or any other triptan within 24 hours. And the ergotamine drugs we used to use in the past, they're not very commonly used now, are Cafergot, Migraine, DHE, or Migranol. So, I hope this discussion is helpful to you. I want to add one little thing at the end of the talk. There has been a problem, according to the FDA, according to the use of triptans with SSRIs or SNRIs. These are all drugs that are worth treating, that work on serotonin in the brain, and they work for helping depression, anxiety, and panic disorder. The FDA has reported that there's a rare risk of development of serotonin syndrome in patients who take both these drugs, and the risk is estimated to be less than 0.03% of patients, and life-threatening events are less than 0.002%. However, there was an error in the FDA report in what they were talking about the drugs, so really there's no risk from taking both drugs. Please see my article on serotonin syndrome for further information on this subject at my webpage at www.drmigraine.com. So thank you very much for listening to this. Please click on subscribe down there so we can follow each other. God bless all you folks who have migraine. I'll see you again on the next talk.